Well, it's been well over a year since we started hearing about COVID-19. That virus, of course, has now altered so many lives across the globe. For some, the virus is a short-lived illness, but for others, symptoms persist. Nicole Christine spoke with one local woman who has dealt with COVID symptoms for nearly a year. She found out about the long-term effects of the coronavirus.
We know quite a bit about what the COVID virus can do to a body in the short term, but what about over time? That's a question medical experts are trying to answer as people report lingering symptoms that are affecting their day-to-day life.
When I beat the virus, so many of the symptoms stayed.
It's been nearly a year since Vanessa Wheel became sick with COVID-19.
For 3 weeks, I just kind of had the normal flu symptoms, and I felt like I was getting better, and then everything plummeted.
The virus settled in her lungs and attacked her vocal cords.
One of them was completely paralyzed and the other damaged, and I wasn't really sure if I would ever speak again or sing again. I'm a musician, so I was pretty disturbed by that.
Wheel says there has been a lot of improvement in her health, but some of the symptoms just won't go away.
I have what I call COVID days, where I temporarily lose my taste for certain foods, or the taste is odd. And occasional fatigue will hit, and it's the COVID fatigue. It's just different.
Wheel is not alone in her post-COVID struggles. Rather, she's part of a group of people experiencing post-COVID syndrome or long-haul syndrome.
The people with COVID, the initial phase, the 4 weeks, that forms an acute infection phase, and from 4 to 12 weeks, it kind of is a subacute phase. From 12 weeks to 6 months, you can have chronic symptoms, and that's essentially become the chronic COVID symptoms, and those are the patients that we are classifying as long haulers for COVID.
So could you be a COVID long hauler? Dr. Josh Cullison, a local physician in Greene County, shares some of the symptoms he's seen a lot in local long haulers.
Brain fog, shortness of breath, chest discomfort, heart might be racing, fatigue. There's a lot of symptoms, and everyone experiences it a little bit differently.
Dr. Cullison says the long-haul symptoms are more likely to show up in people with risk factors related to COVID complications.
The people who are smokers, or they have underlying lung or heart conditions. But with that being said, I've seen perfectly healthy middle-aged men. I even saw some teenage athletes who were really struggling, months after their diagnosis.
Because the COVID virus and its long-term effects are still new to medical experts, treating long haulers has been an evolving procedure.
What we are usually doing is going symptom by symptom and say, hey, if you're having problems with memory and attention, you can do some brain exercises. If you're having debility, let's have some physical therapy and stuff, and go with that.
And when it comes to prevention, both Dr. Khan and Dr. Cullison point to one thing: the COVID vaccine.
The antibody response that you get with the vaccine is much higher than with natural immunity. So if you're getting the vaccine, your antibody levels are going to be higher typically than if you were to get a quote-unquote natural infection and natural immunity.
As a long hauler herself, Wheel has a message for others struggling with lingering symptoms.
Just trust the process, put some faith in there, and just kind of hold on with white knuckles, and you'll get through it.
Dr. Cullison says physicians are working off of a recent report from the CDC which outlines the latest guidance for treating COVID long haulers. He says this guidance will certainly evolve along with the understanding of the virus itself.
And for more information on post-COVID syndrome, including a look at that guidance from the CDC, you can check out this full report on our website, again, mywabashvalley.com.